Thank you for the kind introduction and for the invitation. So usually the question is, what is dental oncology and what does it have to do with any of this? And so dental oncology is really a quality of life service, and the aim is to help patients to limit the complications that they may encounter during their cancer care as well as the years that follow. So what that might involve is during the treatment process, we try and see patients before they start their care to basically evaluate any sources of dental infection. Because when patients begin chemotherapy, it's not uncommon to develop oral infections or oral lesions that can come up as they're going through that process. And one of the long-term things that I see very often in my practice are patients who have received bone-stabilizing drugs. And so if you've received a bone-stabilizing drug, you can actually develop something called osteonecrosis of the jaw. And so this could be exposed bone in the oral cavity. And so this exposed bone could be extremely painful. It can cause the teeth to fall out. It could sometimes be self-limiting, and sometimes it requires surgical intervention. So we don't know who's going to develop this complication and who's not going to develop this complication. However, sometimes we know that it could be set off by a dental surgery. So if you've received that kind of medication, you really don't want to have any sort of dental surgery done. Instead, you want to see someone like myself or another person knowledgeable in the community that can come up with alternative solutions for whatever the oral problem is. So that's really what my mission today is, to give you some basic information and to answer any questions you may have. And I'll also make a resource email available so people can reach out to me after today.
Thank you.